The mathematics of starvation. How Israel caused a famine in Gaza. The grim reality of starvation in Gaza is a complex issue that has been meticulously calculated and controlled by Israel for decades. Palestinians in Gaza are unable to leave, farming has been devastated by war, and fishing has been banned, leaving the population almost entirely dependent on food brought in from outside. Israel has been well aware of the exact amount of food required to sustain the population, initially using this knowledge to apply pressure without causing outright starvation. In 2006, a senior advisor to the then Prime Minister, Ehud Olmert, stated, "The idea is to put the Palestinians on a diet, but not to make them die of hunger." 2 years later, Israeli court documents revealed the specifics of these calculations. Kogat, the Israeli agency responsible for controlling aid shipments to Gaza, determined that Palestinians needed a minimum of 2,279 calories per person per day, which could be provided through 1.836 kilograms of food. Today, humanitarian organizations are requesting an even smaller minimum ration. 62,000 metric tons of dry and canned food to meet basic needs for 2.1 million people each month, or around 1 kilogram of food per person per day. As Gaza has descended into famine this summer, Israeli officials have denied the existence of mass starvation, claimed without evidence that Hamas steals and hoards aid, or blamed hunger on UN distribution failures. However, data compiled and published by Israel's own government shows that it has been starving Gaza. Between March and June, Israel allowed just 56,000 tons of food to enter the territory, Kogat records show. Less than a quarter of Gaza's minimum needs for that period. Even if every bag of UN flour had been collected and handed out, and the GHF had developed safe systems for equitable distribution, starvation was inevitable. Palestinians did not have enough to eat. A worst-case scenario famine is now unfolding in Gaza, UN-backed food security experts said this week. Food deliveries are at a scale far below what is needed amid drastic restrictions on the entry of supplies. The Famine Review Committee, an independent group of experts that scrutinizes IPC alerts, said food shipments have been highly inadequate and singled out the GHF. In response to international pressure, Netanyahu has promised only minimal extra aid. The number of food trucks entering the territory has risen, but is still well below the minimum needed to feed Palestinians there, much less reverse a famine. Airdrops, used intermittently throughout the war, have also restarted, with France, Germany, the UK, Egypt, Jordan, and the UAE among the countries announcing flights, even though parachuting in food is expensive, inefficient, and occasionally deadly. 2 Israeli-based rights groups this week declared that Israel was committing genocide in Gaza, with reports citing evidence, including the weaponization of hunger. B'Tselem described an official and openly declared policy of mass starvation. Israel's government knows how much food Gaza's people need to survive, and how much food goes into the territory, and in the past used that data to calculate how much food was needed to avoid starvation. The vast gap between the calories Gaza needs and the food that has entered since March makes clear that Israeli officials are doing different maths today. They cannot pass responsibility for this human-made famine to anyone else, and nor can their allies. Gaza hunger crisis reaches tipping point. Children suffer malnutrition. The heartbreaking reality unfolding in Gaza is that hunger has reached a tipping point, leaving countless children battling malnutrition and facing grim futures. Experts warn that without immediate intervention, the situation could spiral into an unprecedented humanitarian catastrophe. And this is where it gets alarming. Many of those who survive may carry lifelong scars from the trauma of starvation. According to Kieran Lanning, Senior Director of Emergencies at the International Rescue Committee, IRC, a U.S.-based humanitarian organization, the window to prevent mass death is rapidly closing, and for many, it's already too late. The World Health Organization, WHO, echoes this dire warning, emphasizing that the health and well-being of an entire generation are hanging by a thread. This isn't just about today's suffering, it's about the future being stolen from these children. Doctors and aid workers inside Gaza, operating under unimaginable strain while themselves struggling with exhaustion and hunger, have been sounding alarms for months. They describe a harrowing lack of food exacerbated by soaring prices caused by Israel's military offensive and severe restrictions on aid deliveries. Their worst fears, they say, are now becoming reality. Dr. Ahed Jaber Khalaf, a pediatrician and intensive care specialist at Nasser Hospital in Khan Yunis, shared devastating updates with NBC News' team on the ground. On one particularly tragic day, he reported multiple child deaths due solely to malnutrition, a chilling reminder of how fragile life has become in the region. Adding urgency to the crisis, the Integrated Food Security Phase Classification, IPC, a global authority on hunger, has declared that the worst-case scenario of famine is currently playing out in Gaza, as scenes of widespread starvation emerge, showing emaciated bodies collapsing in streets. The international community has grown increasingly outraged. In response, Israel recently announced limited pauses in fighting to facilitate aid delivery. However, aid officials argue that these efforts remain woefully insufficient. Jeremy Conandick, president of Refugees International and a former official with the U.S. Agency for International Development during the Obama and Biden administrations, described the situation as having likely surpassed its tipping point. Day after day, there are reports of multiple deaths from starvation, he explained in a phone interview. That's new, and it signals that the population has entered a phase of extreme vulnerability. He went on to note that such patterns often precede exponential increases in mortality rates unless swift action is taken. Jeanette Bailey, IRC's Global Practice Lead and Director of Research for Nutrition, reinforced this message, drawing parallels to past famines. Once mortality numbers begin to rise, we must act urgently to stop the tide of starvation-related deaths, she said. Failure to do so will result in a rapid escalation of fatalities. Tragically, the Palestinian Health Ministry confirmed that since the conflict began, 154 people have died from starvation, including 89 children. What makes this revelation even more sobering is that daily updates on these figures only started appearing in recent weeks, an indication of how quickly the situation is deteriorating. Accessing accurate data remains a significant challenge, partly due to Israeli-imposed restrictions on entering Gaza. Yet, Emily Keats, an assistant scientist in international health at Johns Hopkins Bloomberg School of Public Health, agrees that the situation has hit a critical juncture. Without improved access to food and healthcare, she warns, conditions will only worsen. But here's the controversial twist. Israeli Prime Minister Benjamin Netanyahu's office dismissed concerns about the crisis, attributing blame instead to Hamas for allegedly exaggerating the scale of a humanitarian emergency. While political debates rage on, one undeniable truth persists. The human cost of this crisis is staggering. Experts agree that the consequences of this hunger crisis will reverberate for decades. Children growing up amidst such deprivation will bear permanent physical and cognitive impairments. Their little bodies are shutting down, Lanning lamented, pointing to a surge in hospital admissions for severely malnourished infants and children. Child wasting, a condition marked by dangerously low weight relative to height, is rampant in Gaza, according to Keats, whose research focuses on maternal and child nutrition in crisis zones. Even if the famine were addressed immediately, some long-term damages are irreversible. Realistically, children will likely suffer from stunting, micronutrient deficiencies, or both, she explained, noting that these issues amplify risks of adverse outcomes later in life. Dr. Marco Carek, a clinical associate professor specializing in malnutrition at the London School of Hygiene Tropical Medicine, highlighted another troubling dimension. Early childhood, especially the first 1,000 days, represents a crucial period of growth and development. Starvation during this time can cause irreversible harm, not only to affected children, but potentially to their offspring as well. Women who experience wasting in childhood are more likely to give birth to underweight babies, perpetuating a cycle of poor health across generations. Becky Ryan, response director in Gaza for CARE, summed up the bleak outlook facing young survivors. For many children, especially those under 5, recovery may simply be impossible. Malnutrition doesn't just stunt physical growth. It devastates brain development and learning capacity, leaving lasting imprints on individuals and communities. While the priority remains providing urgent aid and medical care to Palestinians in Gaza, experts caution that the repercussions of this hunger crisis will linger for generations. So what does this mean for the world? Is enough being done to address the root causes of this catastrophe? And how should we hold leaders accountable when lives hang in the balance? These are questions worth discussing and acting upon.